Hi, this is Ian Wright, and today I'm going to talk about osteopathy, hearing, balance, and tinnitus. This is a huge subject, and also including dizziness, actually, in terms of, and vertigo. This is a huge subject and quite complex, so I'm going to try and keep it kind of simple, break it down a little bit, cover the basics, and look at actually how we work with these different scenarios with osteopathic technique. So the first thing to say is dizziness is incredibly common, and it can be caused by a huge amount of different things. In adults, probably between 30 to 40% of people have suffered dizziness at some particular time. And you can get dizzy when you've got a cold, or you have the flu, or there's changes in blood pressure, or your neck's locked up, or there's a million different causes of it, and most of them are quite benign. Vertigo, as opposed to tinnitus, is something else. It's a step on in some ways. This is more a feeling. This symptom is the feeling as if yourself or the objects or the room are actually moving around or spinning around you. And there's various causes of vertigo. I'll talk about vertigo first. And there's various causes of it and various types of it. And we kind of have to work out why this is happening. And it's quite common. Again, it's sort of 5 to 10% of adults will have suffered vertigo at some point in their lives. And the most common is actually it's called a peripheral vertigo, which means it is caused by something in the inner ear. Because actually inside the inner ear lie the organs of balance, as well as the organs of hearing. So the inner ear is very important, and that sits in a bone in the head called the temporal bone. The most common cause of this is inner ear problems, like, for example, a cold or an inner ear infection. Actually a cold, if your ears block up, it can cause dizziness or even vertigo. So that can be a very short, acute thing that goes away in a couple of days. Not really going to talk about that because that's too kind of straightforward. There are various slightly more severe forms of vertigo, and the most kind of benign is something called BPPV, benign paroxysmal positional vertigo, which is repeated brief periods of vertigo, which are not this spinning sensation, which are caused by changes in the head position. And they last for less than a minute, and you can feel a little nauseous. Now, this is a particular form of vertigo that who knows why it happens. It tends to happen more as you get older, if you've had a head injury or your neck. But most people say there's no real reason. And one of the causes, the most common cause of that, is these calcium crystals in the inner ear, the labyrinth of the inner ear, tend to come out from where they're sitting in the utricle and into the 3 fluid semicircular canals which are inside the inner ear, and they cause problems. They change the fluid dynamic in these canals and start to cause vertigo. Now, there's a particular test for this called the Dix-Hallpike test, which is actually to do with the practitioner drops your head back and rotates in a certain position, and then you get certain eye movements called nystagmus, which can show that this is the cause of it. Now, there's a variety of different things you can do, a variety of different exercises, and there's a technique called the Epley maneuver, which is to do with, again, extending the head and rotating it in certain positions and holding it and then moving into a certain position and then sitting up. What it's designed to do is to literally move these crystals from where they're blocked in these canals, literally allow them to shift their position so they can go back into the utricle. And it works quite well in that particular type of vertigo. Unfortunately, A lot of vertigos aren't that, and they're something slightly more chronic, or you can get acute issues that develop over time, can be stronger, and you can have them for longer periods, or they can come and go. And people don't quite know why. Certainly with this peripheral vertigo, which is to do with inner ear function, it happens. There's been research done around certain neurotransmitters of the brain affecting the actual nerve channels, and which affects a particular reflex. They're called the vestibular ocular reflex, which is how we relate to the horizon. And sometimes antihistamines help because they can alter that balance. Osteopathically, this is the area which we would spend quite a lot of time. I mean, osteopaths are trained in the Epley maneuver, some of them. There are quite a lot of osteopaths. Physiotherapists are trained in this as well, and some doctors do it. But this other form of vertigo, which is slightly more difficult to address, and that maneuver does nothing for it. And also, you can't trigger it. You can't that kind of eye movement, and so it's not related to that particular thing. And they are harder to access. But as I'm going to talk about a little bit later, it's a lot of it, I think, is to do with the function and the motion of the temporal bone, and that's where osteopaths are very interested in that movement, because the temporal bone has this tiny fluid movement which kind of pumps the movement, and it actually helps with the microcirculation in terms of blood supply, but also, most importantly, the fluids, the perilymph through the inner ear, and that can get stagnant and can pocket a little bit, and you need this to have this constant kind of almost a pumping movement within it, and freeing up blocked temporals can be helpful in that, and that can help a lot of different things, which I will come and talk about. There is another form of vertigo which is slightly more serious, called central, which is more affected by central nervous system issues, which I'm not going to talk about today. But also, actually, it can be affected by neck problems and migraines. So lots of different causes. The important thing about that is to work out why and how to address it. I'm always interested in what's the best way to address this. How do we fix it, if we can? There's another form, which is a more severe form of vertigo, which is called labyrinthitis, which is an inflammation in the inner ear, which is often by a virus or bacterial. These are quite severe, and my eldest daughter actually had it a few years ago, and you literally cannot stand up. It's very, very severe. She literally could not move her head. It's very, very severe. She has no problems now. That's an infection, and it's quite severe, and it's much harder for osteopaths to treat. You can, but you have to deal with the infection. Now let's talk about Menieres disease. Now Menieres disease is a combination of three different things. One of them is ringing in the ears, tinnitus, which I'll talk about in a minute. The second is hearing loss, and the third is vertigo. So you've got this combination of symptoms which are to do with both elements of hearing and balance in the inner ear. And people don't really know why that happens, but it happens as you get older. There are some genetic and environmental factors. People have talked about it being an overreaction of the immune system, like autoimmunity. But again, as I talked about previously, this congestion in the fluids in the endolymph can cause all these different symptoms. And again, if you often in Menieres find that there's a blocking of this functional movement of the ear, and if you free it up, it can help in some situations, not all, unfortunately. So I just want to talk for a second about tinnitus and hearing loss. So tinnitus is, I spent a lot of time working in practice with people with tinnitus because it is incredibly annoying. It's hearing a sound through the ear when there isn't a sound. So it can be a ringing, a clicking, a buzzing even, or even a roaring. And it can be high-pitched, or it can be gradual. It can get worse and worse over time. But it's a symptom. It's not a disease itself. It's a symptom. What causes it? Again, ear infections can cause it. Menieres, as we talked about. Stress can trigger tinnitus. Head injury. Blocked ears. Too much earwax. And often, actually, too loud noises can trigger it. And it can be triggered by flying, etc. If you come down slightly too fast and the ears block up. There is some thought that it is to do with when tinnitus comes with a degree of hearing loss. There is some kind of postulation that it could be how the brain tries to overreact to some degree of hearing loss. So the auditory nerves become overly excited, and as a response to a decrease in hearing. I think that's part of the story, and in some cases, again, this is complex. Let's talk about hearing loss. Hearing loss, I talked about hearing loss and in children, and glue ear especially last time, so I'm not going to talk about this. This is more really for adults. So hearing loss in adults tends to happen over time, noise damage. You get damage to these tiny little hairs and the fluids in the cochlea, or it can be due to the eustachian tube being blocked, as it is in glue ear in children, or in slightly further out, earwax can be blocked, or the eardrum can be ruptured by infections, bacterial infections especially, or there can be nerve issues that can cause hearing problems. Again, we have to decipher what is causing it. Is it nerve or is it blockage? And blockages are great for osteopathy. Nerve damage is, of course, harder to access. So what do we do osteopathically? Well, of course, it depends on what the cause is. What is the cause of this? So if it's benign paroxysm BPPV, you can do the Epley maneuver, which can help free that up in terms of the silt build-up. But more often we're looking at the function of the temporal bone. We're trying to restore motion, drainage, and function. That's really what we're trying to do with ears, is to get things moving, get things free when they're blocked. It's often connected to dysfunction in the temporal bone and or the temporomandibular joint, because the jaw joint, the temporomandibular joint hangs from the temporal bone, which the ear sits in. So any problems with the jaw, a locking of the jaw, or abnormal, if you change the mechanics of the bite in terms of teeth positioning and orthodontics, etc., or you hold a lot of tension in your jaw and you tighten it all up, it can lock up these temporal bones and directly cause problems like tinnitus, like hearing difficulties, like dizziness and vertigo. So we have to, as osteopaths, we have to evaluate very importantly the function of the jaw joint, the TMJ, and we have to evaluate the function of the temporal bones. Are they free to function and move and have this gliding movement? Is it naturally there? We also, very importantly, with regards to all of this tinnitus, hearing, vertigo, hearing and balance issues, you have to look at the mechanics and the function of the upper neck. The upper neck is key because it connects very closely up with the function of the temporal bone, and the upper neck, problems in the upper neck can influence the blood supplies, etc., up into that area of the head. So what we're interested, again, is motion and function and trying to restore what's not there. And also there are other things like, for example, looking at the functional drainage of the throat. Often if the eustachian tube, the tube which I talked about in the previous podcast, is blocked, it can often be a problem with the mechanics of the throat and the drainage of that eustachian tube into the top of the back of the throat. So what we're looking at is stopping this stagnation of this kind of perilymph, this fluidity in the inner ear. That's very important in especially in tinnitus and vertigo, and freeing up blocks. That's osteopathy is very simple in some ways. It's just about evaluating and freeing up areas that are blocked and trying to restore normal function. And we use very gentle hands-on techniques to support and free function. And in reality, I treat people with vertigo, people with tinnitus and with hearing difficulties all the time. Probably every day in practice I'm seeing somebody with one of those issues. And the reality is, some you can help and some you can't. And sometimes I don't know why. It depends whether we can access enough what we're doing by restoring this movement and function. But what I would say, enough change to make it worth a go. So what we do is we normally have 2 or 3 sessions, see if it helps. That's how I tend to go with this kind of thing. If we get improvement, we carry on. If we don't, we don't. But it helps in enough cases, very much so, to make it very much worthwhile doing, in my view. I hope that helps. That's just an introduction to a huge and complex subject. I wish you well.